Hi, my name is Celine Bonilla, and I'm an APRN student attending Purdue University. Today I'll be doing a head-to-toe assessment on you for my Journal 4 assignment. Do I have your verbal consent to do this assignment?
Yes, you have my consent.
Great. So the first thing is just your general appearance. Your posture looks great. Your breathing seems unlabored. You seem alert and comfortable. So everything seems appropriate. I'm going to start with your head. Is it okay if I palpate your head?
Yes.
Okay, great. So here I'm just looking for any bumps, any lumps, any tenderness when I touch.
No.
Good. So your head seems normophthalmic and atraumatic. I do just want to listen to your temporal pulse as well while I'm here. Great. Next, I'm just going to look in your eyes. I'm going to shine a light in your eyes. And I just want to see if your pupils are reactive to the light. But just look straight at me. Great. Great. So your pearl is intact, meaning your pupils are equal and reactive to light, and they're accommodating to light, which is great, which is what we want to see. And they're doing it bilaterally. I'm going to check for ocular movement. So I'm just going to look straight at me, and I'm going to move my finger. So just follow my finger with your eyes. Okay. Great. So your ocular movement, it looks normal, which is great. So next, I'm going to look into your eyes. So we're going to look at your sclera. Your sclera looks great. And then we're looking in the inside, and your conjunctiva looks pink and it looks moist, which is great, which is what we want to see and is normal. Next, I am going to use my otoscope to look into your ear. All right. Nice. So your tympanic membrane, they're pearly and gray and intact. I don't see any redness or bulging in this ear canal. I'm just going to do a quick check on the other one. Okay, they both look good. Great. So next, I'm just going to look up in your nose, okay? Yeah. Okay, good. So, it looks great. Your mucosa, it looks pink. I don't see any discharge, and your septum looks midline, which is great. Next, I'm going to look into your mouth. Say ah.
Ah.
Great. So your tonsils look like they're +1. I don't see any inflammation. I don't see any swelling. I don't see any exudate. Your throat looks healthy. Next, I'm going to look at your neck. So first, I'm going to feel for your lymph nodes. Then I'm going to check for your midline and your thyroid. So I'm just going to palpate, okay? So first, we're looking for any swollen or inflamed lymph nodes, which it feels normal. All right, and then I'm just going to check your midline and your trachea. It feels good. No enlargement on your thyroid. All right. Next, I'm going to listen to your heart, okay? Okay, good. So your heart rate seems regular. I don't hear any murmurs, rubs, gallops, anything along those lines. I'm going to just palpate and check for your pulse. So we're going to start with your radial pulse. Good. Good. And then I'm going to check your pedal pulse. Great. Great. So it's a 2+, which is great. That's normal and it's what we want. I'm just going to look for also your jugular vein to see if there's any distension, which I don't see any. It looks normal. Okay. Next, it will be your lungs. So I'm just going to listen. I'm going to start in the front. All right, just take a big deep breath. Good. Nice big deep breath. I'm going to check the back. Deep breath. Deep breath. Deep breath. Give me one more. Great. All right, so next I'm going to check for tactile firmitis. So if you could please say 99 for me.
99.
Good. Again.
99.
Good. Again.
99.
One more time.
99.
Nice. All right, next I'm just going to percuss. So I'm just going to give you this a little tap on your back. Okay? All right. And I'm also going to do it quickly on your front. Good. All right. So that all looks good. Everything, your percussion is resonant throughout, which is what we want. And your lungs sound great. I don't hear any rhonchi. I don't hear any wheezing. I don't hear anything to be concerned about. They're clear. They're clear to oscillation. Next, I just want to check your skin. Your skin looks good. It looks dry. It looks intact. It looks like the pigmentation is normal. I don't see any rashes. I don't see any lesions. I don't see any signs of cyanosis, which is basically just not getting enough oxygen and be like a blue color. Okay. Do you have any questions, any concerns, anything you want to talk about?
No, I'm happy to hear that my thyroid is not as enlarged. Which is good, yeah.
All right. Well, thank you for coming in today.
Thank you.